Good morning, good evening, wherever you are, and welcome to the Safety Zone podcast, sponsored by the Work Zone Safety Information Clearinghouse, a partnership between the Federal Highway Administration, the Texas Transportation Institute, and the American Road and Transportation Builders Association. I'm your host, Matt Moore with ARTBA, and today we're on part 2 of our series on mental health and suicide intervention in the transportation construction industry. In our last episode, we showed the urgent need for these programs, and today we're going to get down into the tactics of making the investment needed to protect our workers in this critical aspect of work and life. So I'll let my guests introduce themselves. Go ahead, gentlemen.
Good morning or good evening. My name is David Zachry. I'm the president and CEO of Zachry Construction Corporation in San Antonio, Texas.
My name is Jason Westensko. I'm the vice president of human resources for Zachry Corporation.
Albert Flores, Field Training Manager for Zachry Construction Corporation.
Thank you, gentlemen, for being here. I really appreciate your time. Let's go ahead and get started. We have our first question, and that is, why did you decide to invest more directly in worker mental health?
Well, our company has always had very active documented about the last 80 years, documented safety programs and dedicated safety personnel. And really what we have become aware of as society has progressed as well is the importance of mental health and the impact it has on everyone's lives. Our core values begin with every person matters. And so as a component of that, we want to take care of our people, not just at work, but also at home. But realizing that the combination, or that there are things that happen at home that come to work and things that happen at work go home. And so trying to figure out how we comply with our own values and live up to our values was an important thing. We saw statistics a while back about the suicide rates, and that construction and mineral extraction were the two highest industries, and those are our two largest operations. And so with that, with information about the healthcare that was being provided under our benefits plans, we recognized and had to admit that we have mental health issues in our organization, or our team members have issues they're dealing with. They're people, and that we wanted to get more actively involved and proactive about trying to help open a dialogue, help to do away with some of the stigma of mental health, of separating between mental health and mental illness, and then creating a safe environment for all of our people to be able to talk, so that when they can work safely, their minds can be clear, and that they can be the best versions of themselves.
Thank you. So when did you start this process? When did you commit to it?
I said we
Probably over a year
started.
ago.
It's been formally over a year ago. It has been one of the stated components of our business plan, to focus on it, to develop programs and support, to roll different initiatives out, recognizing that we don't know exactly what all of the needs are on an individual or collective basis, and we would rather err on the side of let's do stuff, and if it isn't working, let's change it and keep trying. And so, but it's been a little more than a year of very active involvement.
You know, I appreciate you mentioned that things change as you learn, right? So this question, what type of financial and time commitment was required to initiate the process? But then also, second, what changed and what's now required to maintain it?
What we did, Matt, and that's a great question. Once we decided we wanted to learn more and help address mental health, we partnered with a nonprofit, because we knew that we wanted to help, but we didn't know how to best help. So finding this was an essential part with this nonprofit to help understand on how to educate, and really what was mentioned earlier about the stigma. We knew that was there because of the reluctance for people to talk about it. So the initial investment was partnering with this nonprofit to develop training. So as far as dollars, it was around $30,000 that we invested to get our workforce trained and learn how to best talk about it. And we're excited to share what difference that has made by openly talking about it at all levels in our workforce.
I mean, that's a substantial investment.
Yeah, we think it's definitely worth it. Just the impact that it's having, and we'll share more about that. And to give you an idea of the training, what we learned about this training is people are reluctant to talk about in throughout society about mental health or mental illness, and especially with someone in a supervisory power, right?
Yeah.
They've done research. I'm sure you're aware in studies that there's a stigma with it. So we learned from this nonprofit that if we can educate the workforce, coworkers, find different people that can support, that others are comfortable talking to about it, that's going to be one of the best ways for us to address it. And something that we're all aware of in our workforce, and we call them the 3 R's. This is what we started our training focused on, is to first recognize if someone is having an issue, we say with mental health, or just having something's off. And this relates to what David was sharing about safety. There's an awareness to make sure that people, that their heads in the game, so to speak. So just recognizing if something wasn't different. And we also learned a lot about how to relate to people, and we learned a lot about what not to say, as much as about what to say. So we focused on recognizing, relating, and then the last one is to refer. We don't expect or train anyone to be clinical. We're not clinically diagnosing anyone. We're not providing, cognitive therapy at the job sites, but we refer when that does need to happen. And like David shared earlier, we have benefits to support that.
Yeah, we started changing our benefits program several years ago to provide greater amount of mental health appointments that were covered, that didn't require co-pays, and I think we even offered those to employees who were not on our benefits programs. We've offered mental health sessions for everyone and their families as well.
Yeah.
Well, that's a really good point too, because even if you as a worker are not experiencing something, if they have a family member who is, that's going to come with them and present a potential hazard for them on the site. That's true. So tell me, you mentioned a couple of times you'd like to share some success stories. What are some of those success stories that you have? What's worked out?
Yeah, we'll let Albert. He's been our voice in the field, as our field training manager. So he's the best equipped to share this.
Yeah, success stories are really great, because what I'd like to say is now that people are really starting to ask questions, it's opened up people to. It's a conversation starter now. Where a year and a half ago, nobody was having these questions. Nobody was having concerns about it. So, watching the people react to the training that we share out in the field, as we're reminding people to take care of their mental health, and to raise hand if you need help. We're starting to see people talk about it and ask questions about it, and people are showing concern. So to me and to us, that is a success story right there.
Oh yeah. I mean, obviously you can't give specific examples with names and that kind of thing. But do you have any testimonials or success stories that you can tell us that's real specific? Like, we had a worker who, that kind of thing, that was able to overcome anything like that you can share. Or am I just rambling and we're going to retake this a little
No, you're fine. So we have an internal employee assistance program, which is unique as well. A lot of times that's outsourced. And thankfully, the lady that runs our EAP came from this nonprofit. So she studied psychology, and she's just an amazing educator. She was just sharing with me yesterday, because we're going to do a mental health conference and Albert, we're excited to share about what we call mental health champions. These are people we've trained throughout the organization. But she was sharing that she's working with someone that she thinks is going to be excited to share his or her story about the impact it's had by getting help. So we may have a live testimonial we can share with you later, but I would share, Matt, that we've seen an increase in numbers, substantial increase of numbers, that once they're aware that the support's out there and that we're working on the stigma, we get a lot of people asking for help for their family members and for themselves.
Well, that's great that you have that metric and that you can see that. It's fantastic. Yeah. Before we get to the champions, tell me a little bit about, would you make this investment now, knowing that it took this much to make it happen? Like, is this something that you would do again?
We would have started it earlier. That I think in our workforce looks a lot like the national construction workforce. It's just not normally an environment that the people come to work and that they want to open up in that way. And so just creating the start of a culture that that is caring and nurturing, that you can ask somebody, how are you doing? How are you feeling today? That has implications on retention. It has huge implications on safety. I love asking groups, if you knew that your crane operator, or as a supervisor, do you think it would be good for you to know if your crane operator had a parent in intensive care, a child in an addiction treatment facility, and was going through marital problems? Would that be something you would like to know before you put that person on operating a crane in a critical lift?
Yeah.
The answer is yes.
Yeah.
Then you say, would your crane operator tell you? Have you created an environment that is sufficiently caring and open and supportive for your crane operator to have that discussion with you? And so it is very much a safety issue, and I think a lot of companies throw a lot of money at safety, but and so I think this was just a pennies on the dollar of of the benefit that would get. And frankly, we never even really got to what's the cost benefit. The benefit is so huge, it doesn't matter.
Yeah, it's a 100% no-brainer, isn't it? I mean, that's
really
awesome. So if you have some peers in the industry, for example, people who might be watching this podcast, who are considering new investment or more investment in worker mental health, what do you tell them?
I would tell them that the employees, they're ready for it. We actually were more concerned about what would the messaging be. Are people going to be fearful to talk about it? People are ready and waiting for support and to be able to talk about it. And we, like David said earlier, we could have and should have started earlier. The workforce is ready. People are ready to find solutions and to talk openly, to support each other on this. So there's nothing to wait for to have everything lined up and the perfect training. It's just start the conversations.
Fantastic. Go for it, right? That's awesome. So you used a really great term. It evokes a superhero, a little bit when you say mental health champion. Tell me about what that is and how do you implement that?
Well, if you don't mind, I'm going to take this one if you don't mind. Mental Health Champions, what we did is, like I said, with the nonprofit organization, we partnered up with them and they helped us train up mental health champions. And it works similar to where we have safety managers in every area, right, that can respond to basic first aid incidents that might happen out in the field or injuries that may occur. Now we have mental health champions that can kind of respond to people that are maybe have anxiety, or stressed out, or maybe they just need to get something off their chest, right? And they just need somebody to talk to. And like we were saying here, we're not training anybody to be psychiatrists and things like that. But sometimes, a lot of times, when they're able to talk about something, a lot of times they're a lot better afterwards just by talking about it. So our mental health champions can be there to respond. I believe we have at least 1 to 2 mental health champions at every project is probably the goal.
Correct.
In case somebody's taking a vacation, we got somebody that's just there to help, just to be there to listen and also just to refer them to maybe, our assistance programs and things like that for our employees. So
I love how that's tied in with your other safety champions, as it were, right? Like this becomes part of a greater whole and completely removes any stigma.
Yeah. It's more eyes and ears and peers. So the mental health champion they have a sticker on their hard hat. They went through, it's a full day training of how to help be support. And a lot of the training, Matt, is listening. It's not problem solving, but it's listening, showing that you care, and then providing resources when needed. So
I think a key piece is not putting the supervisors or your mental health champions in the position that you're expecting them to diagnose and treat. That's really important. And so we spent a while making sure that the support structure was in place behind them. So the part of the training is these are resources that are available through our company. We don't want you to be setting up counseling sessions. Get them to professionals. And here's how you do it. And as we started to look at it, that's when we said we don't want to distinguish between our folks in the field who are on our medical benefits programs versus those who are not, they're all ours, and they all have an impact on our collective success. They all have an impact on our collective safety, and we can't have programs that exclude people for choices that they make in their life. Their spouse may have great insurance, and so there's a lot of reasons, and so we had to put a structure in place behind before we actually rolled out the mental health champions out into the field. We had to equip them with the tools to refer people.
No, that's great. If you don't mind me asking, this might be a more challenging question, but so let's say a person decides that at a particular moment they need to speak with one of these champions. Is this one of those things where it's like, okay, come and meet me on a break, or is it a thing like hop off of that paper right now, dude? Let's come and talk about it. Like, what is the tactical way that works?
Matt, whenever we decided on who would be a mental health champion, and we went through that selection process, we needed people that were going to be approachable, people that came in the most contact with our employees. You know, to have someone in an office and to go through it, and they're not going to be out in the field or out interacting with employees. It's probably not going to benefit our workforce out there in the field. But absolutely, we need people to respond right away, because it could be something pretty stressful that individual is dealing with. So, during the mental health champion, we also talk to how to be patient with people, and you need to stop what you're doing and respond to whatever they're needing or whatever they want you to listen to. So that was all taught to us through the mental health champion, training. So yes, you have to be approachable. You got to be a good listener. You got to be a good talker too. You know, you got to be a good communicator. Make sure we're not giving the wrong advice. Those kinds of things. So.
No, I love that. That's perfect. So I guess my last direct question for y'all is, how is Zachry putting out the message out to the field about mental health? Not just and when I say out to the field, I don't just mean in the field, meaning your job sites, but the field in general. How are you getting that information out? What methods are you using to communicate this and to let everybody know, what needs to be done?
I oversee, Matt, our safety training program, where our employees receive 1 full hour. It's mandatory for them to out in the field in the projects. They receive 1 full hour of safety training every month throughout the year. So what we did is we also included a mental health topic in that. So every month they're always getting some type, dealing with stress, our Z-Cares programs, or resources that we have out there. So we're constantly reminding them. So that message is getting out. Like Jason said, we have mental health stickers. We're now doing posters and signs, and we're trying to normalize this conversation about taking care of your mental health.
And it's bilingual.
Yes, absolutely.
Oh, good. I was going to ask that. That's awesome. So your mental health champions are bilingual or able to refer to someone whose is?
Yeah. No todos. Algunos sí, pero no todos.
There's your answer. I appreciate that. I'm done with my direct questions, but I'm really curious what else y'all would like to tell me. Is there anything else that the folks out here need to know? Because I think what you're doing is a really great place to start. I hope it continues to be, world class and grows, and we hear from you more later as your successes grow. But what else do you want to tell folks?
I would say we're learning as we go as well. We've collaborated with other companies in different forums to learn about what they're doing, about its education, awareness, and it's helpful. The more people that get involved in this, the better it is for everyone. We've learned, Albert and I, just thinking back when we went through the training, there were people that in their own personal lives, they could immediately apply the skills with their families, which was impactful. And we've helped with, we trained some students that went through our training as well, students at Texas A&M. So this is something, like was mentioned initially with safety, that everyone benefits, and the more people that are getting involved in this, collective efforts always work better. So we haven't cracked the code, but we definitely know that we're making progress.
I mean, that's the first step, and I really appreciate it. Well, thank you, gents. I can't tell you how much we appreciate what you've been able to tell us today, and we're looking forward to hearing more from you as this progresses. So I'll post down in the comments any way that people can ask more questions and pass along more information. And in the meantime, this has been the Safety Zone podcast. We're just overjoyed to to have you guys on here. David, looks like you wanted to say something.
Well, I was just going to say, we're happy to share what we're doing. We approach this as the same way we do with safety. Is it takes all of us that people end up going between different companies, and if somebody sees something that's working, that's important. The one thing I will throw out that's really important for any program like this to be successful is a degree of trust. Trust in the organization, in the supervisors, in the leadership, that this is something that they really care about. And if that trust doesn't exist, this program isn't going to work, or something like that. It's going to be really hard for something to work.
Also, Matt, can I add something, Matt? There,
please, by all means.
Also, just to kind of close it up, I want everybody, even our own company, we do this as well. Is think about all the accidents, the incidents, the injuries that a company or any one company that you're going to share this podcast with. Think about all those accidents and injuries that occurred, and even sometimes fatalities. How many of those could have been prevented if they were focused mentally on what they were doing for the day on that task? So I just want to leave you with that. So.
Well said. I can't add any more to that. So on that note, we'll sign off, and there'll be some contact information down below here in the comments if you guys want to ask further questions. So thank you, gentlemen, and you have a wonderful day.
Thank you.
Thanks, Matt.
Thanks.